I'm David Carlson. I'm the Director of Epi at Hamilton County Public Health. And before I jump into the specific case use for technology at our health department, I kind of want to walk through where we've been and where we're at with using different types of technology. And then I'll go into the geofencing technology we're using for some of our campaigns, some of the preliminary results that we have gotten so far, and then what we're hoping to use that data for. So early on at the health department, things that were collected by, I guess, the early epidemiologists were mandated certificates and records. These things were usually compiled into reports, either using fairly simple charts and graphs, or maybe just all the records bound together. And oftentimes, these reports only made it into physical print copies. And just as an example, up there was our 1999 communicable disease report and some of the charts that went into that. But as the technology advanced over the years, we were able to do a whole lot more with the data and actually collect a lot more data that wasn't being reported to us. There's things out there that allow us to create surveys for risk factor information or even for surveillance on things that we don't get directly from the state. There's statistical software available to us that allows us to more efficiently clean, manage, and analyze the data. Technology that will help us create better visualizations, allowing us to create things like heat maps. And then also technology available that allows us to get that information out, not only in physical copy, but also digital for people to look at. But as I mentioned, what I'd like to talk to everyone about today is geofencing and how we're using that to collect better data for our media campaigns. And this method utilizes the location of a cellular device to target a particular ad to that group. It's been used fairly commonly among private organizations and companies to send out coupons as well as discounts and advertisements about promotions based on where someone walked into. So some of the common terminology that I'd like you to understand first are things that are clicks and conversions. So in media campaigns, clicks are pretty self-explanatory. If someone clicks on an ad, that counts as a click. It's usually reported in something called a click-through rate. So the number of times someone clicked versus the number of times somebody got an ad. Conversions can vary from campaign to campaign, but in geofencing, we've used conversions to mean after they've received the ad, did they make it to a target location we were hoping to drive them towards? And so how does this work? So individuals that we work with are able to set up geo-boundaries using coordinate systems so that if someone walks into an area, they will get one of our targeted advertisements. This can occur through a couple different ways. In our campaigns, we've been using standard extended displays, which are just, if you were to go onto like a news site or a site like Yahoo and saw the ads on the side, that's what the extended display is. If you were to go to a social media website and got an ad through that, there's actually specific social media messaging that we've used. So visually representing that here, if you look at the red dashed circle, that would be a geofenced location. If someone's cellular device went into that location and had their location services on, they would receive one of our ads directing them to one of our final conversion zones. And so one of the campaigns that we were utilizing this for is the HIV campaign. It started back on August 21st and is running through the end of this month. It not only used the geofence technology for the extended displays in Facebook, but there's also an email component of that campaign. And then here on the right-hand side are some of the ads that were used for this HIV campaign. And so when setting up our geofence locations, we actually utilized our program staff and their knowledge on cases as well as partners that they've worked on with cases to identify areas that we thought would be best for targeting these ads towards. So they went through a list and came up with 50 different locations, including the restaurants, bars, barbers, and salons, different county agencies and locations throughout the county where they thought it'd be best to target people. They also sat down and determined what our final conversion zones were, which included hospitals, health departments, and several partner agencies that do HIV testing. So our preliminary results, again, our campaign hasn't finished yet, but the specific click-through rates for the different geofenced areas ranged from 0% to about 0.46%. Overall, for all sites combined, we're looking at 0.20%. The baseline or average for most campaigns is somewhere between a 0.12 and a 0.17. So we were pretty happy with what we've received so far through this campaign. But perhaps the biggest piece that we're able to get from geofencing that we have not been able to get from other campaigns is the number of times that someone, or in particular a device, made it to a conversion zone. And so far through this campaign, we've had over 3,800 individuals or devices that made it to a conversion zone after receiving our ad. One thing to point out, over 75% of those were at a local hospital. And just so you can kind of see the distribution of the click-through rates based on the different types of geofence locations, this bar chart shows that restaurants and bars, barbers, salons, and then other sites that didn't fit those two categories are shown here. When looking at our click-through rate comparisons, we were able to compare it to an email campaign we were doing with the HIV messaging, the Facebook campaign that didn't utilize geofencing, and then the actual geofencing campaign itself. And you can see that our geofencing campaign performed better than just our social media campaign alone, which is a good thing to report. However, it was not as great as the email campaign that was done. And there's a couple caveats to this. The email campaign is sent out to a much more targeted group of people. It utilizes an opt-in email address list, and so we're able to identify target populations based on race and age that we thought messaging should go towards. Geofencing, you're not able to do that. Anyone who walks into that geofenced area will get the ad. However, geofencing allows us to reach a much broader group of people. So if they're not on that email list, we can try to reach them through geofencing. So we also use this for what I'm calling our Syringe exchange campaign, but it is actually still tied to our HIV testing campaign. This one, again, was running from August 21st through the end of November. It utilizes the same type of campaign messaging in terms of the avenues to get that information out. And the results from this one were about the same. We had, some georeference locations that were 0% all the way up to 0.65%. If we looked at that campaign in general across all the different geolocations, we had a 0.19%, which again was above our baseline and average for a standard campaign, media campaign. In total, we had 57 consumers who viewed that ad and made it to the final conversion zone, which in this campaign was a local health department. And again, just another chart to show the different types of venues that we had that were part of this geofencing campaign. Looking at the click-through rates again, pretty similar to what we saw before. Our geofencing was practically 0.2%. The emails, again, still performed the best, looking at a rate of 2.21%. But interestingly, when we were looking at the geofencing campaign again, the exchange site locations that we had actually had a much higher percent than the overall geofencing campaign. So that's something we hope to take forward into some of our campaigns that are used throughout the county, geared towards HIV and then possibly also the syringe exchange. And so what does this all mean for our campaign? So we're hoping to take these results, because they're not complete yet, and use them to determine which specific ads and delivery routes work best in different areas. Obviously, geofencing allows us to reach everyone who comes to an area, but if it's determined that there's certain georeference locations that aren't performing well, we can always remove those from our list and add new sites to try to have a better campaign. We'd also like to use the performance of click-through rates to identify specific outreach areas, not only through just the typical media campaigns, but for people to go out and provide education in person. So some of our key findings from these media campaigns, the performance across both was close to 0.2%. Really, one of the key takeaways is this geofencing is providing us at least an estimate to understand how many people are getting our ads and making it to our final location for them. Again, in this instance, it's to be tested for HIV. And then the analysis of the click-through rates can actually help us determine if there's specific ads or creatives that were developed for campaigns that perform better than others. Some limitations to consider for anyone who's looking to possibly use this in their own campaigns. It does measure devices and not people. So if you have in your campaign 3,000 hits, it's actually going to only pick up on the number of devices. So someone could be coming through that same area multiple times. A hard part for it is going to be separating the impact of geofencing itself versus all the other campaign components going on during that time, as well as other messaging venues that do not use those same conversion points. So again, the conversion points for the geofencing is that they made it to a location. In typical social media or other media campaigns, you're not going to be able to identify if they made it to that location, so you're going to have to pick a different conversion point. And where do we go from here? So again, our campaigns are still underway. What we're hoping to be able to do is to compare not only the click-through rates, but the conversions across the different geofence sites and identify those that are leading to the best outcomes in terms of conversions. And the biggest one that we're hoping to do is look at how our campaign has actually either increased or not increased HIV testing in local hospitals and other areas. So our health department actually works with the local hospitals in Hamilton County to collect syphilis testing data, and we're hoping to use that same venue to collect HIV testing data to see how this campaign worked. Thank you for your time.